Oh no, you missed the Medicare Advantage AEP. But don't worry, there's actually still time with the Medicare Advantage Open Enrollment Period. Let's talk about it in today's video. So what exactly is the Medicare Advantage Open Enrollment Period, and how does it differ from the AEP or Annual Enrollment Period? Well, the Medicare Advantage Open Enrollment Period is every year from January 1st to March 31st. The AEP is from October 15th to December 7th. During the AEP, you can sign up for a new Medicare Advantage plan even if you don't already have one. That's the key difference here. During the Medicare Advantage Open Enrollment Period, you can only switch to a new Medicare Advantage plan if you're already enrolled, or drop Medicare Advantage entirely if you'd like to switch back to original Medicare instead. So why is this helpful to you, and why do you even need to know about it? Well, it's actually more important than you may think. Every year, people take advantage of the Medicare Advantage OEP for several reasons. They may be surprised by January bills, with copays, deductibles, and new drug tiers higher than expected. Their network may not be what they thought. Perhaps a doctor wasn't in network or a specialist required a referral. There may be medication problems. A prescription suddenly needs prior authorization, or is placed in a higher tier, or isn't covered at all. There's also benefit disappointment. The dental or vision benefits look great on paper, but they don't actually cover what you need. Or perhaps you rushed through or maybe even missed the AEP. It's a really busy time of year for health insurance brokers, and maybe you weren't able to get an appointment because you waited too long. Well, during the MAOEP, you can still make the switch if perhaps you missed an appointment, or maybe just the plan that you chose actually isn't right for your needs after all. You may also want to utilize this time to switch back to original Medicare if it turns out that Medicare Advantage really isn't right for you. A lot of people get confused over the differences between Medicare Advantage versus original Medicare or even Medicare supplement plans. Now, Medicare Advantage plans are an alternative to original Medicare. They must offer at least the same benefits, but many choose to offer additional benefits to entice beneficiaries. Very often, these are things like dental, vision, hearing, and prescription drug. And because they offer these additional benefits, often with no additional monthly premium, or perhaps just a very low monthly premium, they can be extremely appealing. In fact, over half of Medicare beneficiaries are currently enrolled in some type of Medicare Advantage plan, but they're not without drawbacks. You see, Medicare Advantage plans are offered by private carriers, and as a result, you're beholden to a network. Now, you can choose between an HMO or a PPO. A PPO will, of course, give you much more flexibility. However, it's still never going to be anywhere near as much flexibility as original Medicare or original Medicare with a Medicare supplement plan. You see, there's still the issue of pre-authorization or prior authorization. That means that between your doctor and you, and the service or treatment that they've recommended, stands your insurance carrier. Your insurance carrier must first approve the service or treatment. This can be a big problem. It requires more paperwork submissions and possibly delays or even denials. So this is a huge reason that many people opt for a Medicare supplement plan instead. Medicare supplement plans are really just a financial solution to those out-of-pocket costs associated with original Medicare. For example, with original Medicare, in addition to paying your monthly premium, there are deductibles to meet, and then co-insurance or co-pays when you actually utilize your insurance. And of course, there is no out-of-pocket maximum. So Medicare supplement plans will step in to fill those financial gaps. And in doing so, you are actually still allowed to utilize the full range of doctors, specialists, and hospitals who accept original Medicare, and almost all do. However, that is simply not the case with many Medicare Advantage plans. And in fact, many carriers are choosing to leave Medicare Advantage entirely, and many doctors, specialists, and hospitals are choosing no longer to contract with them. So during the Medicare Advantage Open Enrollment Period, you may have discovered that Medicare Advantage simply isn't right for you. So you can use this time to switch back to original Medicare instead. So if you do choose to switch back to original Medicare, how does that process work? Well, of course, first you would need to enroll in original Medicare, which is Medicare Part A, your hospital insurance, and Medicare Part B, which is your medical insurance. You'd also want to enroll in Medicare Part D at this time, which are prescription drug plans. Because remember that original Medicare really doesn't cover prescription drugs except with some very limited exceptions. So that's all well and good. Now, the one tricky thing is that you may not be able to so easily enroll in a Medigap plan at this time. As I said, Medigap plans, also known as Medicare supplement plans, fill in those financial gaps of original Medicare. There actually isn't a specified enrollment period for Medicare supplement plans. You can enroll year-round. However, If you choose to enroll outside of that initial 6-month window when you first turn 65 and enroll in Medicare Part B, then you may be subject to medical underwriting. That means that you could be charged more or possibly even denied. Now, there are some exceptions to this. For example, if you're still within that trial right period of Medicare Advantage plans, you may be able to more easily make the switch. Or if you're in a Medicare Advantage plan and you move out of your services area, then you may be able to more easily make the switch as well. If you have questions about this, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. Also, we do release these videos on a weekly basis, so please make sure to subscribe to stay up to date, and please make sure to like this video so we can get this information out there. All right, let's get back to it. So should you consider using the Medicare Advantage open enrollment period to make the switch? Well, you need to ask yourself several questions. Are you unhappy with your new Medicare Advantage plan? Is your doctor in network? Are your medications covered affordably? Are you overwhelmed by prior authorizations? Do you really need the freedom and flexibility of original Medicare? Do you want to try a different Medicare Advantage plan, perhaps with lower costs? Or have your medical needs changed unexpectedly in January? If you answered yes to any of these questions, this is the time to fix it. So you've decided to make the switch. Well, when does your new insurance begin? So the new insurance that you've chosen will begin the first day of the month after you've chosen to make the switch. So basically, if you make the switch anytime in January, it would take effect February 1st. Anytime in February, March 1st. And anytime in March, then April 1st. Makes sense? You may also be asking yourself, what about Medigap? Now, I did already cover that earlier in the video, but remember that dropping your Medicare Advantage plan willingly doesn't really offer you those guaranteed issue rights for Medicare supplement plans. Also, at this point, you may be wondering about Part D. Well, if you do choose to leave Medicare Advantage entirely, you can choose to enroll in a Medicare Part D plan at this time as well. However, that's only applicable if you're leaving Medicare Advantage entirely. Now, you may be wondering, what about the inverse? If I currently have original Medicare, can I use the Medicare Advantage open enrollment period to make the switch to Medicare Advantage? And unfortunately, no. The Medicare Advantage open enrollment period from January 1st to March 31st is only for switching from one Medicare Advantage plan to a different Medicare Advantage plan, or dropping Medicare Advantage in favor of original Medicare and possibly a Part D plan. If you're new to Medicare Advantage, you would have to wait for the AEP, which is October 15th to December 7th, to sign up for a new Medicare Advantage plan. If you have questions, you can reach us in the comments below or at the number on the screen. We're licensed health insurance brokers, we're licensed nationwide, and there is absolutely no charge for our services. Of course, please make sure to subscribe to stay up to date, and of course, make sure to like this video so we can get this information out there. If you'd like to learn more about Medicare Advantage versus Medigap, I'll put that video over here, and make sure to check out our All About Medicare playlist. We'll see you next time.